not to be detailed today. In terms of the skin, where you might want to do a scratch test to find out if these nerves are innervated and referring pain, you want to scratch the anterior thigh. Even where you believe it's an obturator innervation, you actually get some overflow of the genitofemoral. So look at the toes. Here's the big toe. So this is the right foot, and this is the genital branch up here on the upper thigh, and then out here is the iliohypogastric. And at the moment, I'm at a loss to show the lateral sensory branch of the genitofemoral. I'm sorry, of the ilioinguinal. Again, I stated earlier that the sensory branch of the ilioinguinal fairly overlaps, covers the skin over the tensor fasciae lata muscle. Another consideration that these neuropathies, if they involve the femoral branch of the femoral nerve, can actually refer pain down to the medial calf. That area is supplied by the saphenous nerve, and that nerve is the terminal branch of the sensory fibers of the femoral nerve. So you can get crosstalk inside the cord or crosstalk up high between all of these nerves, and then you'll get a referred pain. And many times people who evaluate the calf pain say, oh, well, that's a sacral dermatome, it's S1, S2. The muscles there are innervated by the sacral nerves S1 and S2. Maybe you have a sacral neuropathy. They get the MRI. No visualization of nerve impingement. They get a nerve root injection at L5, S1, S2. No benefit. It in fact is coming from the femoral distribution, and I in fact experienced that. And of curiosity, the lower half of my thigh did not have any sensory, any phenomenon going on, whereas I did have an ache in the calf area and dysesthesia, and definite dysesthesias in the anterior thigh on the left, and I could even scratch that area and it would turn it on. Today I can do the very same thing. I scratch my skin and I get a little bit of odd sensation in the femoral distribution. So sensitized that if I scratch my right abdominal wall, I turn that on. So that's definitely being processed inside the spinal cord. Okay, sorry to talk so much about me, but that's the way it works. That's how this test came about. And the orange is the femoral branch of the genitofemoral coming down. Okay? And up here is the iliohypogastric nerve. Look how much it branches medially. It looks like it even might cross the midline. And look at it branch down here, and down here, and down here. So there's quite a broad distribution thereof. I believe I've driven the point home. I think we've made a good case for the fact that these nerves do innervate sensory portions of the proximity of the genitalia. Here is the inguinal ligament that we spoke of earlier. The final view here, right here, is the lateral thigh. Okay, so this is the buttock muscle. This is the outside of the right thigh. And up here in the green is the iliohypogastric nerve shooting off some sensory fibers. Behind it are the superior cluneal nerves, which are gluteal nerves that give sensation to the posterolateral buttock and the lateral part of the pelvis, basically overlying the hip abductor muscles, gluteus medius and maximus. That is the end of the pictures I've shown, and I'm at a loss. I need to look at my other books because I cannot find a picture of the sensory branch of the ilioinguinal, which really does innervate a small patch of skin. But again, I advocate a scratch test, scratching anywhere from near the genitalia to above the genitalia, across the lower abdominal wall, scratching down into the thigh, medial thigh, anterolateral thigh, anterior pelvic portion, and lateral pelvic, anterolateral pelvic portion, and you will basically cover those three nerves. Sometimes it's extremely difficult to tease it out and say, based on my examination, it seems like it's only the iliohypogastric, or only the ilioinguinal, or even only the genital portion of the genitofemoral nerve. It's very, very difficult because there's so much crosstalk, and those three nerves come from basically the same area in the spine, or very proximal. So it's very easy to get referred pain. So I tend to link these together. And again, this was inspired by the test that I developed in a very successful response to surgery after 32 years of suffering and, severely worsened, the 5 years prior to the surgical procedure. I would hope that this is helpful in helping other people and preventing a similar type of a pain syndrome. And I want to thank you. You've hung with me for, I don't know how long, it feels like 20 minutes, maybe more. Thank you very much. I'm going to show you, I have a website called heschmanualtherapy.com in which I discuss this. You can go there and look out under inguinal test and you can read up about it. And I do some consultation and treatment. I also teach some seminars that I've developed, and have another instructor as well. We can talk about it in another video. And I also have a physical therapy home study course, distance learning in other words. And if you need to contact me, you can of course find me on the web. My contact information is there. My business is called Hesch Seminars and Physical Therapy. This is my home phone. I am on Pacific time. Please be mindful if you call me to know, please remember if you're in a different time zone. Thank you. I'm in Henderson, very close to Las Vegas Valley. Thank you very much.